phone is ringing. I'm calling for Dr. James McQuay. My name is Fadet, and I'm the student nurse caring for your patient. And I have patient Boy Dubois. He's a 58-year-old male, Caucasian. He is full code. He is allergic to shellfish. He said that his reaction, he have hives whenever he have shellfish. He was administered with osteoarthritis, right total hip replacement. He is complaining of right hip pain, especially when he's ambulated. His past medical history, he had arthritis, gastroesophageal reflux disease, and also hypothyroidism. I took his vitals. His temperature was 99.4, blood pressure 130/72, heart rate 75, respiration 22, and his O2 saturation 97% room air. He reported a productive cough. It was the color of it is white and clear, and it's thin. He said that it's about like little 5 ml. He doesn't have any problem with. He said he urinated way before the surgery, and he said that the only problem he said he had a decrease in frequency, but he doesn't have no pain, no odor, or no urgency. He had a BM also, and it was a little form, normal odor, and it was medium size. He reported 3 out of 10 white hip pain, non-radiating, but he said that it's worse when moving. I checked some of his lab. He had a hemoglobin that was low. It was 11.8. Also, the platelet was 99,000, and it was low also. I know that he was with his hemoglobin being low. I know he just had surgery and losing some blood. And I already see that you have medication for the pain for him, but right now, since he's also taking morphine, I see morphine is one of the PRN medication that he have. I would recommend something to prevent him from having constipation, and also because of his platelet and his hemoglobin, I would also suggest that to get his CBC rechecked in the morning.
Okay.
So you said that, okay, I'm gonna repeat what you tell me. So you say that you will prescribe something for constipation, and also you will put that for him to get his CBC recheck in the morning. Is that correct?
Correct.
Okay. Alrighty. So I repeat back what the doctor said and verify it. And now I'm gonna hang up. All right. Thank you, doctor.
Thank you.
All right. So I'm gonna hang up, and I already have some med for him that was due, some PRN med and some med. And now I am in the med room. I have patient Dubois board, MRI number 7727893. He is allergic to shellfish. His date of birth is 4/30. And then his first medication is levothyroxine 50 microgram by mouth daily, and it's due now. And I'm gonna get his med, and the med that he had, it was I have in my hand levothyroxine, and it's 100 microgram, expiration date 12/20/21. So and then the order was only for 50 microgram. So before I do that, let me do some hand hygiene, and I'm gonna put a pair of gloves. And since it's one of those pills, I'm gonna see if it's one of those pills that you can cut to make sure that I get the right dosage, and also have to make sure that I can cut it. And if I can cut it, there will be a line in between of it, and I will take the pill cutter and cut it in half to get my 50 microgram. So I have it cut, and I have my 50 microgram, and I'm gonna put a label on it, and I'm gonna put the levothyroxine 50 microgram per half of a tablet. And I'm gonna put the expiration date 12/20/23, and I'm gonna put the time is 5:58 p.m. and I'm also gonna put today's date, which is 10/23, and my initial, and I'm gonna make sure I put the label on it. And let me just make sure what I have in my hand compared to what's in the MAR. And I have in my hand levothyroxide 50 microgram per half tablet, and expiration date 12/20/23. All right. And I have Dubois boy 7727893. He is allergic to shellfish. Date of birth 4/30. I have pantoprazole 40 milligram by mouth daily, and it's due now. And in my hand, I have pantoprazole 40 milligram, and I have expiration date 10/20/21. Okay. And I have a third medication. I have Dubois boy 7727893. He is allergic to shellfish. Date of birth 4/30. And I also have morphine 2 milligram IV every 2 hours, PRN, for pain. And I will look inside my drug books to see if I need to dilute or undilute it. And it says that I have to for morphine sulfate for IV. Adult IV 2 to 10 milligram dose. Hold on, let me take these gloves off. I know I seen it earlier where it said you have to, I did. For IV routes, dilute dose with equal or more than 5 ml of sterile water for injection, or I can also use normal saline injection. So I'm gonna, and then also it says for me, whenever I'm giving it, to push it over 4 to 5 minutes. Do not give rapidly. All right, let me do some hand hygiene. I took my glove off. All right, hand hygiene. And now I'm gonna get my morphine. I'm gonna get my sterile water because I have to dilute it. I'm gonna get all my equipment, my needles and everything. All right, let me do some hand hygiene because I'm about to put some gloves on. Alrighty. Alright. I will compare my medication before I will actually look at my medication to see, because for the order is 2 milligrams, so I have to look at my medication to see is for every 10 milligram 1 ml. So whenever I do my math, scratch paper, not on the more, my math says that since I only have 2 milligram order, so I have 0.2 ml for my 2 milligram. So since I know that, and the medication I have in my hand is actually the morphine sulfate, and I have expiration date 10/20/21. And before I start, I'm gonna get my sterile water, and I'm also gonna check my sterile water, and I'm gonna check for expiration date and 10/20/21. And I'm gonna take my alcohol swab. 10 10 to 15 seconds. I'm gonna get 5 ml of still water. And a 5 of air. That's little big needle. Okay, and I'm the needle is big. Okay, and I'm gonna get 5 ml all right. I got 5 ml. Make sure there is no bubble or anything. Okay, I got 5 ml and there is no bubble. Let me just put that just to make sure there is no accident. All right, and now I'm gonna get my 0.2 muffin. I'm gonna get me a new alcohol swab. I'm gonna clean for 10 to 15 seconds. I'm gonna get 0.2 air, 0.2 right here. Now, two, okay. And I got 0.2. Make sure there is no bubble in there. Okay, all the bubbles are out. And it's right here, 0.2. I'm gonna need to stay right here. And now I'm gonna pull back just a little bit so I can make room to dilute my muffin. Oh, I'm the one serving. Just okay. I pull back just a little bit so I can make room for it. And now I am gonna put my muffin in my still water. Mix it in. Throw this away in the shop container. Okay, it's up. Make sure there's no bubble. And now I am gonna put I need it I am gonna do a label for it, and I'm gonna write muffin sulfate 2 milligram per 0.2 ml dilute with 5 ml still water. And I'm gonna put today's date 10/23, and I'm gonna put the times, which is 6:01 p.m. and I'm gonna put my initial, and I will put my label right here, and I will say in my hand I have muffin 2 milligram per 0.2 ml diluted with 5 ml still water, and the expiration date 10/20/21. All right, and I'm done with my fake sheet. I have Dubois board MR number 7727893. I have levothyroxine 50 microgram by mouth daily, and it's due now. And in my hand I have levothyroxine 50 microgram per half of a tablet, and its expiration date 10/20/23. Okay. And I have patient Dubois Boys, MRI number 7727893. He is allergic to shellfish, date of birth 4/30. I have pantoprazole 40 milligram by mouth daily, do now. And in my hand, I have pantoprazole 40 milligram tablet, expiration date 10/20/23. I have patient Dubois Boy, MRI number 7727893. He is allergic to shellfish, date of birth 4/30. I have morphine 2 milligram IV every 2 hours, PRN for pain, and is due now. And in my hand, I have morphine 2 milligram per 0.2 ml, diluted with 5 ml still water, and expiration date is 10/20/23. Let me remove my glove. I am doing hand hygiene. I'm gonna get my more and all my med and my steel not my steel but my normal saline to push everything. And now I'm gonna go to the patient. Knock knock.
Come in.
Okay, I'm closing the door for privacy, doing hand hygiene. My name is Fadet and I will be your student nurse today. May I please have your first and last name?
Boys Dubois.
Okay, boy Dubois, I'm checking. What is your date of birth?
4:30.
4/30. Do you have any allergy?
Yes, I do. Shellfish.
Okay, do you have any what is your reaction?
Hives.
Hives. And I have a MRI number 7727893, and everything look correct, and also see that you have an allergic ban on. Mr. Dubois, I'm here to administer your medication, okay?
Okay.
All right, I have patient Dubois Boy. I have MRI number 7727893. He is allergic to shellfish, date of birth 4/30. And my first med, levothyroxine 50 microgram by mouth daily, and is due now. And in my hand, I have levothyroxine 50 milligram per half of a tablet, and I have expiration date 10/20/23. I have patient Dubois Boy, MRI number 7727893. He is allergic to shellfish, date of birth 4/30. I have pantoprazole 40 milligram by mouth daily, and is due now. And in my hand, I have pantoprazole 40 milligram tablet, expiration date 10/20/23. And I have patient Dubois Boy, MRI number 7727893. He is allergic to shellfish, date of birth 4/30. I have morphine 2 milligram IV every 2 hour, PRN for pain, and is due now. And in my hand, I have morphine 2 milligram per 0.2 ml, diluted with 5 ml still water, and I have expiration date 10/20/23. And let me do some hand hygiene. And let me put a new pair of gloves. Olivia, come in. Okay. And I'm gonna take a brand new alcohol swab. Brand new. I'm gonna clean my hub. And I have my normal saline. I'm gonna push to check. Gonna flush with 5. Okay, I flush it with 5. And it's clear, it's not leaking, it's spitting. All right. And I'm gonna take a brand new alcohol swab. and clean it. And I'm gonna push this morphine in 4 minutes. Now push. And I'm gonna push it in 4 minutes. Slowly, 4 minutes. And my 4 minutes is up. I'm gonna make sure I push all my medication, all of it, until it's done all the way up. 4 minutes. Okay. And then I'm gonna take a brand new alcohol swab, clean the hub again, and I'm gonna take my normal saline water and flush it for 4 minutes, the same amount of time, so I can make sure all my medication going at the same weight for 4 minutes. Okay, I'm done. Now make sure that I clean it up with a brand new alcohol swab and make sure that it's clean. Alrighty, Mr. Dubois, you feel any pain or any, discomfort or anything? You okay? All right. And I also have 2 PO medication for you. The first one is levothyroxine. It's a half tablet. And here you go. All right. Here's some water. And your next one is the pantoprazole. Here you go. Here's some water. And I have both all your med for you. And since I give morphine, I will check respiration to see that he's good. Okay, he's good. Let me remove my glove. Let me document what medication I give. I give the levothyroxine, the 50 milligram I put giving, the time which is 10:23:20, and the time is 6:15 p.m. and I put my initial. And I also have the pantoprazole, the 40 milligram, which I giving is 10:23:20, and it's 6:15 still, 6:15 p.m. and I put my initial. And also my morphine I put giving, and the time, the date is 10:23:20, and it's 6:16 p.m. and I put my initial. Also come down and put my full name, Fadez Sagay, student nurse SN, and I will put my initial right next to it, FS. And I'm gonna make sure that my patient is good, respiration is good after the sulfate, morphine sulfate. Bed is at its lowest position, side wells are up, your call light is right next to you, Mr. Dubois.
Okay.
Remember, don't get up without calling us.
Okay.
And your side table is right next to you if you need anything. Do you need anything right now?
No.
You feeling okay?
I'm feeling okay.
I hope this this med help your pain, and I'm sure you can get some rest, okay?
Okay.
Throw my glove away. Do some hand hygiene. You want me to leave the door open or closed?
You can close it, please.
Alrighty. Have a good day.
Thank you.
Good night.
Thank you.
You're welcome.